好，各位观众，大家好，欢迎收看港湾 TV。今天是8月20号，星期四，照例 BC 省的新冠疫情的新闻简报，在每周一和周四最近从7月份以来就是周一到周四，那么我们为大家现场带来BC 省新冠疫情的最新的通报。好，请稍等。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Rika Gustafson, who is a Vice President of the Provincial Health Services Authority and is here as the Deputy Provincial Health Officer today. And this is our COVID-19 briefing for Thursday, August 20th. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh. Tomorrow, Friday, August 21st, we'll be providing a written briefing. Dr. Gustafson and I at approximately 3 o'clock with case counts and other relevant information. On Monday from Victoria, I'll be joined by Dr. Bonnie Henry, and we'll be providing a briefing in person on that day. And with that, it's my honor to introduce Dr. Rika Gustafson.
所以这个今天还是 Dr. Gustafson。
Good afternoon, everybody. Again, I'm Rika Gustafson, Deputy Provincial Health Officer, and I'm going to give the public health briefing today. Thank you. So today we are reporting 80 new cases in British Columbia of COVID-19 in the last 24 hours, bringing the total since the beginning of the pandemic to 4,825 COVID-19 infections. By health authority, 1,526 are in Vancouver Coastal Health, 2,533 are in Fraser Health, 159 are in Vancouver Island Health Authority, 411 were in the interior, and 121 were in Northern Health. 75 infections were among people who came from outside of Canada. Currently, we have 780 active cases, of whom 11 are hospitalized and 4 are in critical care. 2,574 people are at this time under active public health monitoring. We are sad to report 2 new deaths in the Fraser Health Authority, bringing the total to 200 deaths in British Columbia due to COVID-19. Our sincere condolences to all those who've lost friends and loved ones during the COVID pandemic, and in particular to those who lost loved ones recently. At this time, 3,845 people are fully recovered from their COVID-19 infection. There are no new healthcare outbreaks reported today. There are, however, 9 active outbreaks being monitored by the health authorities in our healthcare system. 8 of those are in long-term care facilities or in assisted living, and 1 is in acute care. Among community outbreaks, there has been 1 new community outbreak with 9 confirmed cases of COVID-19 at Loblaws.
在 Loblaws 我们的在飞沙局下的 Loblaws 就是这个相当于 Superstore 这一类的
there is an outbreak that's being actively monitored, and the update on that outbreak is that everyone in that cluster is at this time considered fully recovered. Public health will continue to monitor for potential new infections until the outbreak is declared over. Health authorities continue to issue community exposure alerts for a number of locations and flights coming into and out of BC. Please do check these websites regularly to make sure that you are up to date on any potential exposures. So what do today's numbers tell us? We do continue to see new infections in British Columbia. The number at this time is relatively stable, but we are continuing to see them. The number of people in hospital and intensive care units remain low. We are seeing a small increase in infections in the 40 to 60 year age group.
那么主要是40到60岁之间的年龄段受感染的人数还比较少这个也是19岁。
in long-term care facility, of course, reflect the vulnerability of this population
那么他也是说到了最近的这个疫情的 COVID-19 到现在为止还是主要还是对这个长期病患者老年人的攻击特别大。
From British Columbians that they are mentally health and sometimes their
那
economic
么现在
well-being
呢，
is
就是也
really
是说到了
being
疫情的
affected
对我们身体
by
的冲击以
the
外，
COVID
还主要
pandemic.
是对人的
We
身
have had
心
to
啊、
change
心
many
理啊、
things
精
and
神
learn new
啊。
ways to safely live our lives. Yet British Columbians have shown incredible resilience and caring and fortitude in this pandemic. In addition to COVID-19, in recent weeks, parts of the province have also had to manage forest fires. And COVID-19 brings an added complexity to that, especially if you have to self-isolate,
那么
especially
也是
if
说
you're
到
at
了
risk
夏天
for
的
severe
这个
disease.
要为
I
秋
can
天
only
做准
imagine
备
how hard。that
那么
must
秋
be.
天来了，这
And
个
I
呼吸道
do
疾
want to
病
assure
会
you
增
that
加，
public
那么
health
新
is
冠疫
working
情
with
会增加
emergency
我们的复
management to
杂度，
support
所以
you
大家
at
一
these
定不能
difficult
掉以
times.
轻心。第二，这要时刻注意
I
自
would
己有
like
没有
to
症
talk
状
a little bit about
这个要
gatherings.
关注自己。
We are actually fortunate in British Columbia to have some of the best public health experts
那
in the
么现在
world
呢，他也是想
working
多
in
说
our
一
health
句，就
authorities
是
and
说
in
我
our
们 BC 省目
universities.
前来说
And
啊，
not
都
only
是
are they
整
doing
个
their own
全球来
research,
讲，
they're
我们的公
constantly
卫系统还
reviewing
是比较健
research
康
and
的。
data from both
那么
around the world, but also our
那
local
么我们现在
experience
从
to
科研
bring
系
that
统啊，
information
从
to
这
bear
个
on the
各
decisions
个
that we
进
make
展方面
coming
都
up.
还是
You may
正
not
很
know
好
them, you may
啊
not see。
我
them
们时时
regularly,
刻的把
but
我
they
们
are
的信息
tirelessly
都做
working
个
to
啊。
keep all of us
那
safe.
么，所以大
And
家
one
的
of the
每一
things
个
that they're
做法，
finding
每
is
一个
that
人的工作，都会
regardless
为
of
我
where
们
we
的
may
公
be
卫
in our
公共卫生
province
做
and
出
what
贡
we
献
may。be doing,
所以
we
这
have
个是
seen
希望
that
大家不
indoor
是说啊，这是
gatherings
你
that
们的
are
事情
encouraging
啊，这是
very
大家的
close
事情。
proximity tend to be an
所以希望
important
大家能
source
够
of
尽量避
transmission.
免，
The
能
two
够不要
notable
在
things
这
about
个
these
室内
gatherings are
聚集，
crowding
室
and
内
in
是
some
最
cases
最
alcohol.
这个风险最高
These are
的。
often small outdoor
那么希望
gatherings
大
that
家
are
还是要引
different
起注意，
from
就
controlled
是一个
settings
不要
such
人
as
群
an
聚
office
集
or a
啊，
classroom
有时
where
候
you
如
know
果
who is in the room and you can more easily take precautions.
所以这个还是在教室里边也是，实际上马上就要开学，希望
to spend
大家一
time
定
with
要
people
注意，
you
不要
know
再
and
长
to
期在
always
室
stay
内
at home
长
when
期
you
聚
are
集
sick.
啊。
By
如
doing
果
this,
你生
you are
病的话，或
supporting
者不舒
not
服的
only the
话，
public
就不要
health
出去
teams,
了，待在
your
家
family,
里
your friends
啊，
and
自
your
己
community
不要
to
跟
stay
你家的
safe.
家庭和
While we
社
still
区
have
都保
much
持
to
安
learn
全
about，
我们都会给
COVID-19,
你
we
强
do
烈的
know
支
that
持
by。continually monitoring for
那么
clusters,
这
quickly
个医
managing
生
new
和
cases, and containing the
这个
spread,
医生
we can
和
protect
Bonnie
those
Henry
most
还是不
vulnerable
能
and
比
keep
啊，大家
ourselves
觉
and
得
our
他
loved
就
ones
在
safe.
读 ，Bonnie
Please
Henry
do
也在读
understand，the
但是
risk
Bonnie
and be an
医生给人就一种
influencer.
娓
Support
娓
your
道
friends
来的
and
感
family
觉
to do the，right
像一
thing.
个很慈祥
And
的
we
一
all
个老太
recognize
太
that this COVID-19 hasn't
老阿姨
been
大妈
easy,
给
but
你
we
一
can
种
be
娓娓
sure
道来
that by，
给你
continuing
讲
to
道
work
理。
together,
而这
we
位
will
这
get
个
through
副
this.
医
And
官
I'd
呢，
like to
就
thank
是
you
巴拉
again
巴拉
for
巴拉
all
巴拉
you
巴
are
拉，
doing.
反正就是在读啊。Bonnie医生也在读，但是呢，他语速慢一点。
And
第
I'd
二
like
呢
to hand it， back
就
to
是
Minister Dex.
给人家一种这种安慰啊，这种劝告。那么这位医生其实他讲的
Thank you
内
very
容
much,
和
Dr.
Bonnie Henry
Gustafson.
一样，只是呢
And first of all，
他就巴拉巴拉巴拉巴拉
to say
啊，
on
就是
behalf
读
of
完
the
算数。
government of the Premier,
那么
to
今天
express
这个
our
他也是说代表省长
condolences to the
这
families
个
and
是
friends
对
and
过
the
去一
communities
天
and
失
the
去一个
caregivers
亲人的
of the two
家
people
庭
who
表示
passed
诚挚
away
的哀
in the
悼。
last
那
24
么也
hours
是
from COVID-19 in care in Fraser Health. We
那么
know
也是非常卫生局下
what
的
a difficult
他也是说到这个是大家我们大家都面临着困难的挑战。特别是那些200个家庭啊，现在是200个死亡所以家庭我们也是给你们诚挚的哀悼。我们的心永远跟你在一起你们的损失、你们的痛苦，我们都知道。
Significance in and of themselves, they remind us, I think, of the extent of the loss.
这个是也是告诉我们生命的宝贵。生命的重要，始终是提醒我们这个我们求情连续疫病这个除了5月到6月份，还有除了新冠以外，还有346个死亡这些都是非正常死亡不一定是 BC 省的死亡那个COVID-19 的死亡，还有一些其他的，反正这个呢都是给大家的这种诚挚的哀悼。
And I'd say that in the last 24 hours, our church community in this case has been dealing with this loss. Reverend Blake was an extraordinary minister and an extraordinary man. And I think what he probably reminds us of here today are things that are good public health messages, that we have to, in difficult times, seek ways to find joy and to find happiness and to be together either virtually or with our loved ones in ways that keep us safe. He probably tells us to lift ourselves up when we fall and to avoid at all costs blame. And we need to do this because we're going to be dealing with this pandemic for a long time. He probably tells us to protect and to empower the
呀，大家所过的生活和往常不一样，希望大家不要这个不负行为的责任给大家带来责怪，同时 也把这个责任这个后果带给别人，这个是不可的。现在的这个时间是困难的，也是充满着挑战的所以我们很多人身边都有失去亲人、朋友、家人所以这个都是很好的。所以我也是代表这个所有的 BC 省人我们一起和你站在一起，跟你一起哀悼。我们也听到了你的痛苦的声音。那么同时呢，我也是要感谢我们 BC 省的公卫系统的全体工作人员感谢他们的辛勤工作努力我们从这个每天看到的数据看到了我们 BC 省现在整个病情的上上下下起起伏伏，所以这个也是看到了公众的焦虑、公众的安全。那么大家也可以打811的电话，也是那么像811的电话从6月份的7万多个电话这个是那么昨天只有2728个电话昨天一天的所以这个都是看到了公众这个焦虑，但是同时大家也看到了我们 BC 省应对这个新冠疫情的所做的努力。
That number was 1,700. The number yesterday, as I said, was 2,728.
那么这个昨天这个数字，说实话，他说是流行病以来是我们是最低的一天收到的811的电话，这个也是看到实际的下降数字。那么我们现在又开了5个，尤其是在这个菲沙底下开了5个测试点。主要是满足于兰里、阿布斯福以及 Hope 这些地方的测试服务工作。那么也看到了延安卫生局下的努力，包括在列治文也是扩大了这个营业时间，大家都可以去，还有1个礼拜7天都可以去测试。
Fraser Health, it's about 26 hours. In Vancouver Coastal Health, 24 hours. In Vancouver Island Health, the turnaround time is 16 hours.
那么他也是说到了菲山卫生局也是延长了26小时，一周不是一天才24小时。那么他说，举个例子，昨天一天就测试了4027例。
A positive rate of around 1.8, 1.9%. We also have, as Dr. Gustafson said, 2,574 people who are effectively under public health surveillance, who are
那么现在呢，刚才也是说的有2500多个，我具体没记下来现在是住在我们的公卫系统的监督下，在自我的那包括生病呢还是不生的，就是自我隔离的有2500多个人都是都在我们公卫系统和工作人员的监督下
public health is doing what they do.
那么他说，简而言之来讲我们公卫系统该做的都要在做特别是保护长期护理院那么希望能够拯救更多的生命这个8月份是尤其困难。
That work is. I want to just briefly, and I'm sorry I'm taking more time than usual. I just have a couple of reports that we typically give on Thursday. On May the 7th, we of course released our commitment to surgical renewal. On May 18th, we resumed non-urgent scheduled surgeries. Between May 18th and August 10th, we completed 77,264 surgeries,
那么我再给大家讲一下，不是所有的网友都一开始打开我们的直播昨天一天，这个是我今天从7月份到现在最兴奋的一天了，新增18个，我一开始以为是80个，因为英文 18 和 80 有时候是听不清楚，但我刚才趁大家可能不对，我趁机回看了一下，的确是18个，新增18个，总数是4825个那么新增1例死亡，住院的是11个，其中4个在重症监护。那么现在呢，目前记录在案的案例是780个活跃案子那么累计到现在是3845个痊愈。那么其中呢，累计到现在为止，延安卫生局是1526个，菲沙卫生局2543个。那么这个 岛上卫生局是159个，内陆卫生局是411个，北部卫生局是121个。那么从国际上带回来的就是境外BC 省境外的现在已经有75个了这个是给大家再讲一下。那么这个卫生厅长还没有总结完就是恢复择期开刀的联络情况以及开刀的落实情况。
We'll be profiling how we'll improve efficiencies and increase surgical cases in several of these specific surgical areas, beginning with ophthalmology. There are nearly 23,000 cataract cases waiting for surgeries, about a quarter of our wait list.
那么刚才呢，这个卫生厅长也说了一个呢是增加了很多测试点，第二呢，像 Richmond 温哥华测试点呢都是增加了营业时间，所以呢大家都可以去测，因为原来是说过就是需要测去测，那么后来呢他们的语境改了，说你觉得不舒服你就去测，换言之你去测好了，但他不能说你来测就行，不像川普说这个说你们每个美国人要测就来测了，你们想测就来测我们 BC 省不是这么说，是说你需要测你就来测这个是语境上是有点区别但是就是其实就是你要测就去测了，所以这个也导致了呢前一阵子这么多人。那么这是今天的一个感官。第二个感官呢，也就是说那个年龄段，那么还是强调了20到40段年龄段的受感染人数还是最多的这个也是实事求是来讲，他说40到60岁的还是比较少。那么第三个呢，就是 Dr. Gutson 说了，也就是说到了这个一定要避免这个长期的室内的聚集。
Next week it'll be 7 months since we started providing these briefings.
那么从第一期简报到现在，他说已经很长时间，已经超过半年了。1月，他说1月份我们在那个 CDC 那边，他说设立的波尼医生和我一直在已经很长时间。
Twice during the past many months, I've drawn upon the words of Dr. Michael Ryan of the World Health Organization. Early on, he said something I've drawn upon when times were harder in our BC fight. He said that in a pandemic, we have choices. He said we can give up or we can fight.
那么也是说到了大家就选择权都在大家手上，你要么放弃，你要么再坚持下去这个都是取决于大家。我们现在是取决于是战斗，跟病毒战斗不要去放弃，不要轻易放弃。
PET CT scanner will start helping patients at the Kelowna BC Cancer Centre for the first time outside of Vancouver.
那么这也他说到了 PET CT， 这个 PET CT 是什么呢？是全身扫描这个 PET CT 是相当好的一个东西，也就是说深度扫描一下就可以知道一个人到底身上有没有癌细胞那么今天他也是说到了这个BC 癌症协会、癌症总医院的事情那么也是感谢这些癌症患者。他们付出了这个额外的痛苦，因为很多因为医院资源都为了应对这个疫情，所以呢很多开刀都慢慢。当然，如果有生命危险或者医生认为必须开刀的，肯定开了。那么他今天主要还是感谢那些其他的病人你们所付出的额外的努力和你们所面临的额外的挑战。
We take a long view in a pandemic, but this weekend, let's take a shorter view, one that sees us step away from the coverage of COVID to safely living our lives despite it. The activities we do, the outings we can take, and the connections we can safely make that remind us of what we have to do in our lives, of who we have in our lives, and how we are renewed and restored when we strengthen these connections. Everybody has their own comfort zone. Within it this weekend, let's head to a park or a beach.
那么每个人都有自己的舒适区你希望今年的夏天和往年不一样不要在和往年一样的舒适区里边再走了那么你可以选择到海滩上去聚集，也可以选择待在家里。那么他也是说到了，就是这个也看到了很多人必须工作辛勤的努力的人，希望你也为大家考虑，希望你为大家整个社会考虑这个你放弃也在你手上，与病毒做斗争也 是在你手上啊，这个一定是行之有效的，一定是取决于大家共同的努力。所以这个也是我觉得这个是很好的一个说法。那么我们也知道了这个所学会了各种各样的技术，如何去应对这个病毒。
It's been an honor to stand with Dr. Gustafson this week, who is an extraordinary professional.
那么他说也感谢 Dr. Gustafson 他是上星期一和今天那么下星期又是新的星期，那么可能下星期伯尼亨利还回来，那么他也是感谢那个Dr. Gustafson 的这个精湛的技术也是感谢他的这个给我的协助。今天两位官员这个读稿子的痕迹还是比较重那个伯尼亨利也在读，但是伯尼亨利给人种感觉慢慢的有更口语化的。不是英文里边的长句子来告诉你，因为一般人说话不会用长句子，只有书面语才用长句子，所以呢，这个就算同样的稿子，如果在这个 Bonnie Henry 他的嘴下读出来，你觉得听得进去，他一下一下跟你娓娓道来，然后他说了3个 be calm, be safe, be calm, be safe, be kind 这个是很著名的。那么这个 Dr. Gutson 他因为说实话他也是第二次，他也不可能做得很好他也是一个副主席BC 省医疗协会的副主席。那么现在就是这个
Thank you, Minister. And before we take questions, a reminder to the media to please press star 1 to line up for questions. We will be taking one question and one follow-up this afternoon. And please do not mute your phones. You will not be heard until I call your name. We begin today with Keith Baldry, Global News. Keith, go ahead, please.
Hi, thank you for this. Regarding your talking about 811 calls, there's been a serious surge in the number of those calls. If we keep on our average this month, August we'll see more calls.
那么这位记者问的是811的电话 call 量的问题，因为刚才卫生厅长说了811的 call 量，也是说到了7月份、8月份已经降价了，昨天是最低的一天，等等等等那么他想把这个问题根据进去。
Well, it doesn't just lead to testing, although you're quite right. That's one of the questions it does. Just to put it in context, the total calls answered in March were 41,880. But
他说3月份的时候是41000 3月份的时候最高的一天5000多个 call 量电话量。
5,070 calls. On other days, for example, March 26th,
那么3月27号811电话的话也是5070个。那么之后呢，开始4月份的时候呢慢慢下降。那么这也是反映了大家对这个疫情的焦虑慢慢恢复平静那么昨天呢，我刚才说了才是2728个电话量这个也是和7月份的就同期的差不多，7月份是2668所以我们不单单是现在电话不单单是这个新冠疫情，还有其他的扩大的范围，所以这个也是看出了这个和这个疫情来临之前的电话量是差不多了那么现在是那么测试呢是过去的24小时内，我认为已经测试了4000多个人。
I wouldn't say that the number of calls is anything like at the height of the pandemic in March, but it reflects
那么他说了，我不是说好像3月份是最高电话量，我只是想说明就是电话量的下降也是表明了一个呢我们的公卫系统的工作的到位，第二他们的这个额外的工作第二个呢也是人们这个焦虑的这个平静那么同时呢也从特斯拉来看，越来越多的人全省越来越多人接受去到 BCCDC 这个相应的测试点去测试。那么也感谢这个 BCCDC 这支队伍，他们给我们一个额外不寻常的服务他们这个队伍是相当棒的。
Yes, the number of people in isolation, more than 2,500, is more than doubled in a little more than a week. I know the case numbers, of course, are higher than they have been, but is this an example, and I think you mentioned this in the opening remarks, of contact tracing really being effective here?
Yes, so one of the reasons that the number of people who would be in isolation would increase is if a single individual wwho was infected
他说这个自我隔离的人数增量的为什么这么增加因为我们一直强调了避免大人群聚集，就是因为这些聚集了导致这些人希望他们是自我隔离因为我们找到他们了，所以我们希望大家避免这个人多的聚集，就是因为我们能够快速的找到跟踪他们这个能够找到迅速的找到对我们公卫系统来讲能够快速有效的找到这些聚集的人，所以这个伯尼医生其实也解释过为什么50个人。
That the new cases today are largely people in the ages of 40 to 60. So previously you've mentioned that cases in young people happened largely at parties or gatherings. Is there a trend in the new cases today?
那么今天这个说了18个，主要是40到60个了。那么之前说的是20到40的，是不是趋势有变了？那么他是说不是，这个趋势看起来20到40岁的还是在会增加。那么今天的这个变化只是说明我们的关注点有点变化因为有些人这个年龄段开始有这个严重的疾病了，那么他们引起的这个阳性案例会导致这个更严重的生病。而且呢，我诚实的诚实的告诉大家，这个年龄段包括有基础病的这些人，他们得病的严重性会很大，而且会容易这个对生命有危险。
Hi, thanks for this. I'm just wondering, in Alberta, Dr. Dina Hinshaw has tweeted out that everyone who's going back to school, so that includes teachers and school
那么他说阿省的人呢已经说了，希望大家不要上班都能够鼓励大家去测试不要去开学。那么我想问问看那个 BC 省也是比如说有一个 Mission 的一个研究院也是。那么很多人都是无症状的感染。
It's not an option that the science tells us we should take.
那么他说我不认为这是科学的办法。
We look at the evidence very thoroughly and make decisions based on what is likely to make a difference. One of the things we know about testing people who do not have symptoms is that the yield or the positivity rate is extremely low.
那么他也是说到了无症状的人，他们的这个阳性率很低很低。这个也是科学的方法希望我能够。
Really declines in testing that is associated in people who don't have symptoms. So basically what you find is that neither a positive test nor a negative test tells you a great deal in that situation. So no, we would not recommend that as one of the ways that we want to make sure that people stay safe and are safe. And so that is not something I'm anticipating in British Columbia.
他的意思没有症状的这个阳性测试下来，阳性率很低很低，所以呢，重点还是希望能够把测试重点放在那个有症状的人身上。
Hi, thank you. I was just wondering what thoughts are on BC ferries making masks now mandatory instead of having that as a recommended
这位女记者问的是 BC 这个渡轮是不是强制戴口罩？
that masks, albeit they are the lower
那么他也是说到了这个在防护层里边戴口罩是还是最低层级的。
often a very visible sign that people and organizations choose to implement. And so in the context of situations where you are interacting with
那么他说了，如果你和其他人互动的人你不知道他们你不能保持
significant distance
正确的社交距离，那么额外的一层保护，那么可能口罩戴得有效。
With respect to making it mandatory or recommended,
那么会不会是做强制，还是这个我们的只是建议？那么这个是要根据每一个地方去他们自己决定。这个也就是说，这个大温公交系统强制戴口罩，不是亨利医生的决定，是那个TransLink 当局自己决定的啊。
preventing people from being able to make an appointment to go get tested. What is your message to the people who want or need to get tested to see vulnerable family members but can't right now because of this issue?
I think it's being resolved. So my message is that we resolve these problems as we go forward. The relative turnaround of testing results on island health and tests take place.
那么他说这个问题已经解决了，也就是说这个问题就问的是岛上的测试的问题，可能他们的等候的时间很长，也就是说你去测试的时候要3天以后才能知道结果。这个呢，已经他说这个问题已经解决了。我相信这个可能增加了一些什么测试手段啊，引进了一些新的测试，因为美国才15分钟就能知道。那么大家可以看到我们 BCCDC 的这个数据都能看得见啊。Dashboard 我到现在还不知道中文如何确切的说，可能叫面表盘啊，就是我们 BCCDC 也有个网页上也有这个面表盘啊，大家都可以看到这些数字，每天都在更新，大家都能认识到实时的我有多少人测试过了。那么我们到现在为止还没看到很多的人的地方有爆发的情况啊，在岛上啊。那么他们的这个岛上的卫生局的测试的阳性率也是5个里边最低的啊，也是属于不是低的一种，不是最低，因为还有北部卫生局。那么因为岛上的这个微弱群体很多，相对来讲那边的易受攻击的群体更多，那么他们那边还是做的比较好。所以他说，我认为你刚才问的问题已经解决了，困难已经解决了啊，所以这个大家不要再我所关心的关注的应该不是这个问题了。
So the province has announced the hiring of 500 additional people to help with contact tracing. So do you have some more details to provide at this moment, such as the recruiting timeline, and if the actual workforce will help work on some new contact tracing technologies?
So I can follow.
Yes, we've received, and forgive me, I don't have in front of me the email for people who may be interested in these positions, but in front of me. But it's available. If you go to the BC government website or the BC CDC website, you'll be able to easily find that to express an interest in these positions. We've had hundreds of people respond to those positions to be to work in contact tracing in this pandemic. I want to say 2 reasons why it's important. One, we have a significant group of people obviously engaging in contact tracing now. You can see this based on what Dr. Gustafson has reported. What we want to do is increase our capacity. So should the need for more contact tracing increase in the fall, we are able to respond to that staff that is there. Should that not happen, then the hiring of these 500 contact tracers will allow the rest of our public health professionals to go back to their regular duties in addition to
他们每天的工作就是职责就是这个跟踪来支持我们的这个公卫系统，所以我们现在仍在处理当中，可能是9月份的时候能够完成雇佣工作，所以我会给大家给大家报告这个情况。
Yes, so I would like to know if we see like a more severe resurge of the COVID cases, how are we considering about introducing some new technologies to improve and enhance our current system of contact tracing?
那么也是这个跟踪接触的工作，有没有考虑引用新的技术来促进我们的跟踪的工作，改善这个工作？那么他说，简短来说是的，我们在考虑我们已经和联邦政府和省政府一起发展研发这个现在的这个技术。我们现在包括这个安省现在都在研发一个新的 APP 啊。我如果说 app 大家不知道，那么我现在也会邀请这个 Dr. Gustafson 他现在呢邀请他们的团队都在考虑这个如何跟踪这个改善跟踪工作。
To have an experienced person talk to you
他说我们也在考虑，希望找到一些分享经验的人，他们感受过这个测试过这个病毒
especially in February limited the growth in that period of COVID-19 in BC. It's extraordinary work that's done, and it's the bread and butter work of public health. And I'm going to leave it to Dr. Gustafson to talk about it a little more.
Thank you very much. And yes, we are exploring technologies and any information system
了，我们的确是发展了很多的技术和手段。那么这个呢是
clinical care that you're providing to someone who's either has
那么也是就是说跟踪接触工作，这也是需要大家去提供你接触过的谁谁是谁你接触过联系过，所以这个也是大家一个最基本的工作这个也是我们的我们所关心的问题这个也是我们需要了解，我们也要为什么我们要雇佣这么多人去做这个跟踪接触工作所以也是给大家一些忠告，如果碰到了这些情况如何做。所以因为这个跟踪接触工作也不是人人能做的，而是需要有诊所的这个基础的知识的人去做的。所以我们要确保如果有人有这个病毒的话，那么接触过的人如何去找到他们所以还有他们如何去回答别人其他人的问题如何解答解惑。
And Dr. Gustafson, thank you for taking my question. We have been getting some complaints say that they want to get tested, they're told to get tested, and then when they go line up, they can't really find anywhere where they don't have to wait a long time.
那么这位女记者问的就是测试的问题，有些人想测试不知道哪里测，而且要排队，根本不知道什么时候被轮到测试。那么他说你们现在说的测试容量一天是8000，但现在才4000还很低很低。那么如何去改善这些工作这个女记者问的还是比较尖锐的。
Of which Dr. Gustafson is justifiably proud because of the information it provides. We provide that information every day, and what you're seeing is exactly that, a response to public demand for more testing. So I believe the number today, and this will be confirmed by the dashboard at 5 o'clock, is around 4,200 tests that were performed yesterday, of which we had 80 positive tests, as Dr. Gustafson has reported, and that's an increase in the demand for testing that we saw before that.
测试需求增加，所以这个测试的完成量也增加了。这个是我们测试完成量是完全按照这个测试要求来做的这个也是反映了这个，而且同时呢，我们的测试的营业时间也在提高测试点在增加。那么他说这个其实有时候一天也要求测试量才1800个，那么不等于说我们必须要用完这个8000这个量所以这个也是我们只是反映了大家需求的量。所以我们的测试容量一天是8000个这个是放在那儿的，实实在在的。那么现在到了秋天和冬天的话，还会要增加，可能会到要2万个测试量。那么不等于说你的测试量2万个每天就要用足我们不等于，只是我们有反应我们也对这个病毒的这个情况有所应对，这个所以也是为我们如何应对和准备，在医院里边包括是在这个诊所如何准备，特别是秋季如何应对等等等等。
Yes, this is actually for Dr. Gustafson. I'm getting lots of emails from people that are still concerned about just how airborne this virus is, and that they are worried that there's a lot of research out there suggesting that it can live a lot longer in the air than it does, and that we're not really getting the full picture about it.
Well, those individuals can really be reassured. Whenever you have a new virus, there are a lot of studies that are done on what can happen.really matters to us is what does happen. And we are over 20 million infections around the world, and the behavior of this virus is now known. And we know that the way it's behaving is that it's transmitted in situations with close proximity with others who are infected. And that is not the feature of an airborne virus, or not a feature of a virus that is transmitted efficiently when airborne. These are the features of viruses that are transmitted through close proximity actually what we call droplet spread. The other thing we know is that if there was a substantial contribution of airborne transmission to COVID-19, then the things we are doing that are actually stopping transmission wouldn't be working. So basically what we know is that there are a lot of studies out there that explore what's possible. What matters to us is what's probable and what's actually happening. And this virus has told us how it's behaving, and the way it's behaving is not airborne spread.
Thank you. And the next question comes from Nick Johansson, Castanet News. Nick, go ahead, please.
I'm not sure who this question is best suited for, but with the fires here in the Okanagan, what, if any, changes have made to evacuation protocols in light of the pandemic?
So we have been working with Emergency Management BC and have created specific guidelines to make sure that the evacuation processes and centers are taking into account the potential for COVID-19 transmission. So to make sure that those activities include the prevention measures that we need to have, such as hand hygiene and appropriate separation. So I do want to tell you that some time ago, actually, at the beginning of the pandemic, or I would say at the beginning of the summer, the combination of these events were considered, and the plans and evacuation plans were adjusted accordingly.
我们其实在做应对的时候，都会想到了这些因素，包括撤离，包括山火的爆发，我们都已经考虑到这些因素了，都已经做了足够的预案。
Whether they were COVID positive or because they'd come in contact with a COVID positive person.
So such an event has not been reported to me. So my understanding is that that time, at this time, there are no individuals in that situation reported. However, that's that changes, we certainly will update you.
对不起啊，我一直觉得这个 dashboard 不好说。谢谢，这个就是。
Oh, hi, thanks very much.
这个叫布告栏，好的 ，dashboard 叫布告栏。那布告栏是不是叫 bulletin？ 这个 dashboard 应该是更偏重于数字，但是布告栏目前来看是最贴切的。谢谢你。
So in British Columbia, after careful review of the evidence, we do not recommend testing of people who do not have symptoms of COVID-19.
他现在还是说不建议，如果没有症状不要去测试。
In that situation.
这个听懂了吗？我刚才跟大家说了，川普说你们都来测试，没有症状也来测试，我们15分钟就知道结果。但是这位我们的 BC 省的他就说因为这个无症状的测试下来的阳性率很低很低，他说不建议大家没有症状的话就不要来测试。
Transmission of this disease. In exceptional circumstances, when a medical health officer is managing an outbreak, they may consider that.
情况就是当卫生官员在管理有一个地方有疫区爆发的时候，疫情爆发的时候，那么他是要每个人都去测试的。这个也就是说，你没有症状，他也是他的理由就是说，没有症状测试出来的阳性的比例很小很小很小，也就是说，那么就是你没有症状就不要去测试了。那么他也是刚才说到了，只有一种特殊的情况，也就是卫生官员他在负责这个地区，他发觉这个地区有疫情爆发了，那么也是鼓励所有人去测试。
being tested are testing negative for COVID-19. A very high rate of positivity could mean one of two things: you're testing the right populations, or there's an actual increase in testing and increase in infections. It is a way of comparing testing capacity with the actual circulation of virus in the population. I don't know if Minister Dix has anything to add to that. It's something that we do like to monitor as an indicator of making sure that we're testing the right populations and that our testing is appropriate for the level of circulation of virus.
Thank you. The next question comes from Glenn Korstrom, Business in Vancouver.
Hi, yeah, thanks for taking my call. The question is it's sort of a follow-up for Minister Dix. I asked you about a month ago about the hiring at seniors homes, care homes, so staff.
这位男记者问的还是1个月前Andrew Dix 部厅长问的问题。这个就是关于长期护理院的雇员、雇工额外的省政府 分拨了1.65亿的美元的加币的这个资金这个他说这个数字不一定对可能是1.65亿这个是一个方案就是额外的雇工，因为现在一个养老院只有一个雇员嘛，那么现在有很多短缺等等。那么他说我想问这个问题跟踪，那么这个卫生厅长就在回答这个问题，他说这个数字可能是相对的数字，不是这个确切的数字。那么他说我们现在一开始是做的就是这个探访的制度的恢复这个已经现在大家各个护理院的探访都已经扩大了，都已经有落实了。
One of the reasons we started so cautiously is it's going to take some time to put all of these measures.
那么还有其他的措施呢？到位的话还是要些时间这个包括每个人指定的访问者
is ongoing with
所有的这些工作都在进行当中都是在全省的所有的长期护理院里边都在进行那么还会有宣布这个额外的这个雇员的这个计划还会有。
About the hiring of people in the thousands, and so some significant work is being done on this, and you should expect.
那么现在还在做这些重要的工作，那么可能你会，那么具体的雇佣的具体的详细信息，你会马上会听到。那么最近不会现在马上宣布，马上会告诉大家。那么他说有些长期护理院是允许有多个访问者来探访老人。那么可能是在这个门口可能是在室外那么天气要冷了，那么室内如何转到室内那么还会不会坚持一个老人只能有一个探访者来这个记者问的相当好，天气要冷了，我也是在想现在是8月份9月份以后很多开始冷了，很多店门不能关了，对吧你排队怎么排然后这个很多的问题，夏天来了是没有问题冬天来了怎么办？那么他也是说到了，就是这个探访者事先要预约登记，第二呢要戴口罩等等等等这个现在可能暂时还不变将来可能要变。
In terms of what happens in some care homes outside, but essentially the designated practice, the supported practice, and that laid out by the provincial health officer and the Ministry of Health is that each senior or person in care will be allowed a designated visitor. There are, of course, exceptions to that under our essential visits policy, which you will know in specific circumstances and palliative circumstances. People living with disabilities, for example, both in acute care
指定一个人来看他，那么有些好的条件好呢，可以，他刚才这个记者说了，可能指定2个到3个都可以。那么这个呢，都是5月份之前是不可能的5月份6月份的时候都是养老院是不允许去探访的。那么现在也是说的，这个厅长刚才也在说了这个是7月份以后变的，那么7月份之前呢都没有的，那么怎么
Thank you very much. As I understand that
应该是数字报表也行，数字报表也行，布告栏也行。感谢大家，我觉得你们2个说的都对，因为布告栏呢还多了些文字，数字报表图表可能更推荐一点，但是呢它也不是一个表格，所以有待商榷。反正呢 dashboard 大家都听得懂你们都是我的老师，谢谢你们。
One of the things to consider is that if you consider what we now know about COVID-19 and COVID-19 transmission and who the vulnerable populations are.
那么他说我们现在对于新冠疫情的病情最高的风险的人群是什么最高的传播的风险在哪里这个传播的途径是什么大家都应该很清楚了包括这个接触的东西包括很多人的行为这个大家都清楚了包括那些年纪越大呢这个风险就越大
From a disease control perspective
那么从这个疾病控制的角度来讲所以我们还是要看到很多有危险的地方我们还不会开慢慢开放这个是小心谨慎的逐步开放
Do you have a follow-up, Lisa?
那么现在就是说到了，就是这个赌场还没有变啊，很多人是等不及了要赌场去，可赌场还没有变。
Looking at the dashboard last time, and the surveillance reports look like they weren't travel-related, but community exposure. So, can you expand on what that means?
So when we report cases as an exposure in the community, early on it can be, as the investigation goes on, it means that these individuals didn't necessarily get it from a known case or a known cluster, but they were exposed somewhere in the community. Often early in the investigation, we don't know where that is. One of the things that we are finding, however, is that as the investigation proceeds in British Columbia, at this time, in the vast majority of cases, the source of the infection is identified.
那么现在呢，随着人多开始多起来了之后，数据量开始多了。那么现在看起来就是知道数据感染来源哪里，就慢慢让大家很清楚了。
That means that we have known chains of transmission.
所以我们就很清楚了这个感染的数据链、感染链在哪里。因为我们还有很多的一些卫生工具去能够找到他们接触跟踪的，然后找到这个病毒的传染的途径。所以这个你们大家看到的 dashboard 上的数字都会在变，就是因为这个变化。
We in British Columbia throughout this pandemic have been able to identify the vast majority
所以这个也是随着我们的调查的跟踪的进一步的发展所以呢不断的做在调整。一开始的时候的对不明来源的这个病例呢都放到了 community exposure。那么现在呢，大家随着人数越来越多那么 BC 公卫系统的工作人员呢，这个跟踪接触慢慢知道了这个病毒的感染的一条链，所以呢，就是这个病毒感染的这个它叫 community exposure 的数字就下来了就等等原来因为都归纳到这儿那儿去这个还是开学的问题家长们比较关心焦虑孩子们不能够这个保证这个社交距离。
Will the primary strategy be simply to rely on contact tracing if something happens rather than trying to prevent spread among those classroom groups?
那么也是说到了，你们是不是你们的策略是
No, actually the plans are very much designed first and foremost to prevent cases of COVID-19.
他说我们的策略是防止而不是跟踪这个是100%的决定的我们是防止感染不是说去跟踪感染这是我们的决定做出任何决定的策略特别是开学的策略
The other end of the gradient is to reduce really close face-to-face contact with individuals. And there are absolutely ways to do that in the school setting. So in other words,
所以他说在学校里边我们主要是面对的就是孩子们面对面的接触导致的病毒的传播
So actually physical distancing is possible in the school setting.
所以在学校里边的所有的设置里边主要是保证孩子们的距离物理距离要保证
It's part of a comprehensive set
所以这个也是我们的一个综合防御的计划里边的一部分保证孩子们能够包括还有孩子们的洗手如果还有给他们支持如果他们在家里边的话我们的教职员工如何支持他们如果他们生病或在家里边我们什么然后呢如何减少孩子们的聚集这些都是我们在学校考虑的综合性的复杂的这个计划那么重要一点话呢我们也是当然了要快速找到这个新冠病毒爆发的情况那么学校永远不会是在社区之外学校永远是在社区里边的所以我们在所以我们在学校的校区我们在社区的一些这个防御的计划措施一定用在学校里边都是一样那么这个呢 log law 数字控制板更加好数字控制板也很好谢谢你那么也是说到了这个用工上班的地方的感染的情况因为今天宣布 log law 有一个感染爆发那么他说的工作地方爆发也是只要有一例就是宣布这个爆发 那么这是希望用法语来回答。
Oui, il y a 9 personnes qui travaillent pour l'Ordre de Surrey qui sont en question pour un test
那么刚才这个 Dr. Jackson 也是说到了，就是一例发现了一例在 Lobson 里边有一例，我们就宣布这个工作场所是在那个疫情爆发。那么这个呢是最后一个问题，也是这个最后一个问题是用法语回答，所以就没有。那么各位观众，可能不是所有的观众从一开始就听我们的直播，那么我再给大家啰嗦一下，昨天一天新增18个这个是从7月中旬到现在为止最低的一次了，18个。那么总数呢是4825个，新增移离死亡很不幸。现在呢11个住院，4个重症监护，11个里边4个重症监护。那么其中呢1526例是在沿岸，2543例是在这个飞沙卫生局，159个在岛上，411个在内陆，121个在北部。然后呢，这个外省或者是国际上带回来的是75个。那么现在记录在案的活跃案例是780个。好，那么今天的这个他们的这个，让我再给大家总结一下啊。我把这个数字呢已经是报告给大家了。那么再看看啊，也就是说，目前为止是11个住院其中4个在重症监护。那么18个我再给大家，因为我比较兴奋了，今天有点兴奋了，18个。那么也感谢A 拼音是 CI 应该是词这位网友，以及这个 True 应该是赵女士，是台湾或者香港，谢谢你们给我的帮助。Dashboard 我下次都要引用数字控制板或者是布告栏，我都要说。那么这个也是谢谢你们两个对我的帮助和支持。那么明天呢是书面的，也请大家留意我们的网站或者是微信了。那么下个礼拜一还是回到维多利亚省政府地下室。那么这个礼拜2次呢都是在 BC 这个 Canada Place 的这个温哥华 downtown 的这个地方。那么下礼拜还是回到省政府的地下室，那么也是 Bonnie Henry 还会回来。好了各位观众，感谢你们的收看，我们下期再会。